Banning words. You may have heard Governor Rick Scott ban state employees from using the phrase climate change. Now, the Trump administration is giving staff at the Centers for Disease Control a list of banned words, many of which are raising alarm in both the medical and civil rights communities. ABC 7's Adam Cellini spoke with both groups and joins us with more. Adam.
Yeah, Alan, that list has 7 words on it, and some of the ones that are raising concern include fetus, diversity, and even transgender.
The library is continuing to grow, which is exciting.
Also Youth is Sarasota's sanctuary for kids and young adults in identity crisis. Nathan Broomer is executive director of the LGBTQ nonprofit, helping these kids navigate a world that doesn't always understand them. But even he doesn't understand why a national agency would ban a word like transgender.
It raises some questions. And I think what you see with these words, unfortunately, is an attempt to erase some Americans from the conversation.
That word is one of 7 staff at the Centers for Disease Control and Prevention in Atlanta were reportedly told to avoid while preparing an upcoming budget. A policy analyst told the Washington Post about that list, which includes other words like diversity, fetus, and science-based.
There are very specific programs and outreach that the CDC does to the transgender community. So I don't know how they can do their job as a public health agency without meeting those needs.
Parag Shukla has similar questions. As Associate Director of Clinical Research at CAN Community Health, Shukla says limiting language should always be a concern.
Language is everything. Language is everything. It's always about communication, because it is the research that we do and the information that we gather has to be displayed and portrayed to the patients.
CAN stands for Community AIDS Network and is dedicated to the treatment and care of people living with HIV/AIDS. Medical Director Tanya Schriebman, who runs clinical trials with AIDS patients, says those listed words are quite common in these halls, especially science and evidence-based.
Yes, well, I can't really imagine not using them in clinical research. It's kind of standard of care with medicine, and it's standard of care and research to use that type of terminology.
It's much more personal for Michael Lamb, the nonprofit's peer navigator who helps others living with HIV, some who are transgender.
So you're removing a whole person, so it's like, are we kind of pushing them out of the way of care and their whole existence?
The Department of Health and Human Services' response to the initial Washington Post report is that it was, quote, a complete mischaracterization. An HHS spokesperson told ABC News the HHS will continue to use the best scientific evidence available to improve the health of all Americans. Also, CNN acquired a memo the agency's director, Brenda Fitzgerald, sent to her staff, using 2 of those banned terms to describe their mission. However, this does come after rollbacks on transgender rights from the Department of Education and the Department of Justice, leading Broomer to believe this report is part of a larger trend happening in Washington.
This kind of messaging repeated from our administration absolutely has an impact.
Now, Alan, according to several reports, staff at the CDC were given alternative phrases for some of those words, including science and evidence-based, but not all of those words.
Okay, Adam, thanks a lot.